Hello everybody, welcome back to another video. If you're new to my channel, my name is Josh and I am a pre-med student currently in my sophomore year of undergraduate studies. In this episode, we're going to be reacting to some Dr. Pimple Popper with a severe case of Rhinophyma. If you've not seen my first episode, link it up in the corner. I got another reaction to her. Go check that one out before you watch this one or after. Definitely both worth the watch. Other than that, let's get right into it.
A call from Dr. Sandra Lee. She called and she reached out about a patient, but Roger's case was extraordinary. He doesn't really fit in a plastic surgeon's office. He's not really a cancer case, so he doesn't fit in a head and neck oncologist's office. So he would fall through the cracks in a normal situation.
I am so excited.
Right off the bat, you can see those growths on his nose are the Rhinophyma, and those not only are going to be making it difficult to breathe, to eat, drink, stuff like that because of the location of it, because it's hanging down, the weight on it might be painful. And you could see that he didn't have just one, but two of these growths on his nose, making it probably, super irritating, maybe hard to sleep, roll over, of course, breathe and eat. And then just like the doctor said, it's tough because if he's not in a specific person's style or specialty, I guess, then they don't really know where to put him. So like she said, she recommended him to these guys. They were saying he's not really a cancer case. He's not really, a head and neck, tumor really case, but they're going to do it anyways. But that'd be kind of tough because if she's not able to do it and she would normally be the one to treat it, then she recommends the guy to somebody, and obviously wants to see it through all the way. If she can't proceed in her office, she obviously wants to see that they turn out well, and which is why I'm sure she's here talking to these doctors about this procedure. But yeah, that's sad. That's a sad situation to be in.
So excited about this and what it's going to do for him. I know it's a long time coming.
Yeah, absolutely.
We're happy that our foundation is able to kind of contribute.
What is this foundation?
It's the organization that has allowed us to travel around the world and do these missions internationally completely free of charge for patients. So the foundation is actually covering anesthesia, OR costs, literally everything that has to do with it.
So that's actually a pretty common thing. I'm not too sure about private practices, but at least some pro bono cases in hospitals where they have a certain amount of budget that they plan for those free types of cases where, insurance doesn't cover it, the person can't pay out of pocket for it, so they have maybe $100,000, $1 million set aside, whatever it may be, to do these types of free cases. That's definitely something that I'm looking forward to. I want to set up a foundation doing some kind of pro bono free surgeries for those who can't afford it, but those who also need it most.
Surgery.
You just gave me goosebumps. I mean, there's so many moving parts that were necessary to allow this to happen. This is a big deal. This is a three-pronged procedure. First is the intubation and anesthesia, and this is risky because of a potential airway obstruction. Number two is the removal, which is risky because of the loss of blood. And number three is reconstruction.
Just the sheer size of the tumor.
So yeah, she said just the size of it makes it really tough to maybe get a tube in there to breathe for him while he's under anesthesia. She'd probably have to find another way to do it, which could be either a thyrotomy or a cricothyroidotomy, which would be when you essentially just cut into the cartilage of the throat, the thyroid, and that's where you put the tube if you can't fit it through their nose or through their mouth, or, you'd probably have to do it through the mouth, obviously, with a tube like that. What is that, an NG tube? Because it wouldn't be enough through the nose. But yeah, with something like that, when that's exactly where you're working, you're not going to have the tube here when you're cutting right above it. I don't think that would make a lot of sense. So it's a good thing they're thinking ahead, and I'm sure they've obviously got plan B. So if it doesn't work, they're obviously going to have to do some sort of thyrotomy, or what is that called, a cric. I've heard it called a cric. I don't think they use that term really anymore, rather than just a tracheal tube. Yeah.
It's completely blocking his nasal passage. And the second one is blocking access to the oral cavity. And normally when we put someone under general anesthesia, we have to be able to give them oxygen. We know somehow we've got to get him under general anesthesia without having normal access to either his nose or his oral airway. We'll have to put a small incision in the neck, open the actual windpipe, the trachea, and then put the tube in there, and then hook him up to the anesthesia machine.
So the question now is, am I right? Is it a tracheotomy or is it a cricothyrotomy, cricotracheotomy, whatever it may be? I'm not sure. I think a cric is in an emergency situation, so they're probably just going to do a tracheotomy, is what they're going to call it, instead of cricotracheotomy or cricothyroidotomy.
All right, so Roger, we're gonna start by shaving your beard and mustache, and just so we can see what's going on with the rest of the skin. Is that okay?
Yeah.
Roger is having his beard shaved for a few reasons. It really is obscuring our ability to see the area very well. And certainly it can be a nidus for infection. It takes away some complication from this already very complicated surgery.
So I know at least when it's coming down to brain surgery, they partially shave the head and wash the scalp due to bacteria being there, or they don't want any complications with the shampoo or conditioner that you use. And then they wash your hair and shave part of your head there. So similar to here, they shaved his beard because you want to see the plane that you're working in. Obviously, you want the best field of view for the least likely possibility of complications, as well as a breeding ground for bacteria, because it houses a lot of bacteria that you don't want to cause infection when you're having a major surgery such as this.
Dr. Osborne is taking a tube with a camera to be able to see down into Roger's windpipe, and once he sees there's an opening to his lungs, he's going to pass a tube that contains oxygen to be able to supply his lungs so that we can breathe for Roger.
Nothing. No CO2 back.
All right, a little bit more, see if you see.
Now, I'm no doctor, but I don't know if that's him struggling to breathe because he had a tube down there, or if it's just because he physically can't breathe that well in this moment in time. I don't think that's a good sign, but I also don't know if that's common in these types of surgeries.
Placebo. Roger?
I don't like it. Let's get him some oxygen.
So the anatomy of Roger's larynx is not normal. This means that Dr. Osborne cannot properly pass a breathing tube into this passageway. So really, Dr. Osborne has to move to plan B. Dr. Osborne is going to make a little opening that allows Roger to breathe, which is a tracheostomy.
I was close. Tracheotomy. Yeah.
Luckily, the tracheostomy worked, so Dr. Osborne and Dr. Hamilton can now continue with the procedure.
All right, let's get started.
33.
I wonder if they're going to tell us. I wonder how long a procedure like this takes. I know at least with one of them it would take a very long time, so I can't imagine two, as well as having to deal with putting him under, doing that tracheostomy, as she said.
This tumor will bleed. The worst thing that could happen is Roger could die from this surgery. All right, let's get started.
33.
You could lose so much blood in a matter of minutes. It would be nothing for him to be in cardiac arrest if someone were just to try to lop this off. There'd be no way you would stop that bleeding.
Dr. Osborne has just made his very first incision into Roger's Rhinophyma, and bleeding is a major concern.
Blood runs from high to low. So if we started with this one, which we saw, it bleeds a lot. All that blood's gonna run down into our field, so we'll start low and deal with the bleeding here.
Obviously a well-experienced surgeon, otherwise he wouldn't be doing a case such as this. But yeah, blood runs from high to low. So obviously, also just due to gravity, you're not gonna have the blood in a lower sac flowing upwards towards that upper sac. But if you cut the upper sac first, then you're gonna have blood bleeding down into where you're gonna wanna cut next, obstructing the field of view, stuff like that. Really smart.
We have this sort of motto, go slow to go fast. And essentially what that means is take your time, identify the blood vessels, control them, rather than just cutting through them. So we've got a circumferential skin cut without too much blood loss. That's nice. But I can already see a big vein right there. Bipolar. Bipolar.
Dr. Osborne is using a bipolar electrocautery tool, which really allows you to seal the blood vessels as well as cut it at the same time. And sometimes there's some bleeding despite that because the blood vessels are so large. And that's why Dr. Hamilton's coming in with a little vacuum and pulling up that fluid, because if there's too much fluid in the area, the cauteries don't work.
So what you can see, obviously, Dr. Pimple Popper, Dr. Sandra Lee, has used an electrocautery herself in a couple of her removals videos, stuff like that, helping other people. But yeah, if you got too big of blood vessels, it doesn't matter how much you cut, or I guess how much you try and cauterize the bleeding, because if it's a big enough blood vessel or vein or whatever it may be, then you're not going to be able to control that. So it's smart that he saw right away So what he said is the motto is to go slow, to go fast. You can waste a lot of time trying to, cover up what you could have avoided in the first place.
Piece now. Here it comes. There we go.
Wow, they removed that entire huge piece with very little bleeding. So that is in itself a huge victory. Even if nothing else happens today, we've really improved Roger's breathing, removing that first big lump.
The biggest challenge here, I think you're just gonna go straight across something, like I'm just gonna lop it off. You're gonna end up lopping off part of his normal nose.
I mean, that looks like a...
Portobello mushroom
Yeah.
coming off.
Sandra Lee always makes a bunch of these food comparisons, talking about how it looks like oatmeal or mashed potatoes or butter when she's popping pimples or taking out cysts, scooping them out of somebody, and she's like, oh, it looks like mashed potatoes. And he just says it looks like a portobello mushroom burger, removing that giant lump, making a food comparison. Obviously, great friends. If they're making the similar kind of food comments, that's pretty funny.
You say portobello, I say potato. The skin could accommodate so much there. Dr. Osborne was able to successfully remove the superior tumor as well. Most importantly, he allowed there to be extra tissue there to really aid in proper reconstruction of the nose. Dr. Hamilton is a plastic surgeon who works really closely with Dr. Osborne at the Osborne Head and Neck Institute. He's one of the best plastic surgeons around, but reconstructing Roger's nose to become a fully functional nose may be his greatest challenge yet.
Honey, open your eyes. Hi, we are finished.
Hi, you look fantastic. This is one of the most amazing transformations I've seen. Certainly, I'm so proud to be part of it as a dermatologist here, and it's going to look even more amazing when we give Roger some time to heal. You look so good.
Remember, when you woke up, you were gonna feel awesome and look handsome.
I'm so proud of Roger. He has been through so much. Many people would have given up when he persisted. There were many times he came to my office where he was thinking that he was going to have something removed, yet he was sent back home. And I'm really, really proud to be a part of helping him just become a normal member of society, which is such a basic thing that we all take for granted. He's going to be able to go to the store, just not feel like people are looking at him or staring at him. He no longer needs to hide, and now he can thrive.
So that is pretty much it. Dr. Osborne and Dr. Hamilton were able to get all of the Rhinophyma off of this man's nose. That was a pretty complicated procedure, something that you obviously wouldn't see very much of, but it's so awesome that they have a foundation that's able to provide the funds for the surgery to be done pretty much pro bono, so the guy doesn't have to pay anything out of pocket, or if he doesn't have the insurance to cover it, that they can cover for him. Awesome to see. I'd love to see a follow-up though, just to see how he recovers, how it looks, maybe 6 to 8 months after, something like that, just to see how well he heals and how well it looks overall. You can see even when it was bandaged up at the end, they removed all those growths and it looked pretty much like a normal nose. They also said they have a plastic surgeon, one of the two doctors, I think it was Hamilton, was a plastic surgeon who obviously made his nose kind of sculpted and look like a normal nose after they removed all those growths. That is awesome to see. If you want to see some more Dr. Pimple Popper reactions, let me know down in the comments. There are a bunch of these awesome videos, I find awesome at least. Let me know down in the comments if you did enjoy. Drop a like and a subscription, and I will see you all in my next video. Peace.